Nolene Fredericks, Chief Medical Officer. The Ministry of Health has been working together with the Ministry of Education, Social Transformation, as well as the Pan American Health Organization in organizing an island-wide survey of school-aged children between the ages of 8 to 11. And we will be doing this survey in the week of April 24 to get an idea of our status in terms of schistosomiasis or bilharzia. We do believe that St. Lucia has practically eliminated this disease from our country. Persons may recall that years ago we had a huge problem in terms of bilharzia, but right now we're seeing very few cases. And in order to determine whether we have actually eliminated the disease, whether it is at such a low level that we don't necessarily have to really be paying so much attention to it, we need to do this survey amongst young children to see what what percentage of them might be affected by the disease. And we are hoping, we certainly do believe that it will be a very, very low percentage. So as a result, we have been meeting with the schools. Parents will be informed, and Mr. Shabatis, our national epidemiologist, will give you a better idea as to how the sample was selected, because really and truly, we would have liked to be able to involve the whole country and every child in every school into the survey, but because of limited resources, we may not be able to involve everyone into this survey. So we're just informing persons that the survey will be occurring soon. So you may be hearing more about it. Your child may or may not have been selected randomly to participate in the survey. And we are certainly encouraging parents for their support. We look forward to your support so that St. Lucia can verify that we have eliminated this disease.
My name is Nahum Jabatis, and I am the National Epidemiologist of the Ministry of Health in St. Lucia. As the Chief Medical Officer mentioned earlier, we are undertaking a survey to try to find out the level of prevalence or the percentage of school-age children which would show us whether or not they have Bilharzia or schistosomiasis. Now, why school-age children? We know that we had eliminated that disease way back sometime around 1985, but we have, over the last 10 years, seen about 37 cases, and among them one school child. We chose school-age children because school-age children will give us a much better sense of recent transmission rather than if we take some persons who are older, because the disease could remain in persons for many years. And so even if we get a high prevalence among older people, it will not tell us about recent transmission. Why elimination? We want to document and certify with the Pan American Health Organization and the World Health Organization that we do not have the disease. We want to we are seeking the cooperation of the public, particularly parents, in giving us permission to do that survey. You'll get a little more details of the survey. We are working in very close collaboration with the Ministry of Education and particularly the parents who are selected. I want to spend some time on the selection. You may ask, why your child? We were not able, or we could not interview or have everyone in the study to participate in the study. We had to select a few. We have to select those. We have to find a random method, a method which is not influenced by any choice of anyone working in the survey. And so we had to go through and select from the 9,000 children, about 2,000 children to enable them to participate. This is a very important survey for two reasons. First of all, to tell the world that we no longer have schistosomiasis in St. Lucia, but most importantly, to find out who, if we have any recent transmission happening, to stop that transmission, to try to identify where are the focus or the areas where we still have transmission happening, so that the Ministry of Health can move very quickly to eliminate this disease. This disease is a very debilitating disease. In fact, we had communities in St. Lucia that had as high as 60% in the past. Diseases are things, are events that if you give them a chance, even if you have eliminated, you have to keep on working towards preventing them because they will resurge. So again, we are just asking that the entire public, not only the parents, support this survey so that we can have a high-quality survey and show the world that we no longer have schistosomiasis in St. Lucia.
Schistosomiasis, or Bilharzia, is a disease which is caused by a worm. And this worm goes through various stages, actually two main stages. One where it can infect human beings, and another where it infects certain snails which live in fresh water. So essentially, if someone who is infected with the disease urinates or defecates near a stream and the water, for some reason, the water gets contaminated, this and the infected person would release eggs into the stream, and these eggs would hatch in the water. And then the little worm would find its way into a particular type of snail which lives in water, and we do have this snail in certain parts in St. Lucia. We have recognized these snails in like the northern area, like in the Abdominal area. We've seen them in the Miko region, in Soufrière, so they're in different parts of the island. These snails are in the rivers, but they can also be found in little streams. And in one case, we actually found some of the snails that can transmit Bilharzia right next to a main road in one of the communities in the north. So the snails are available. So if, like I said, an infected person infects the water, these would hatch in the water, then they would find their way into the snails, and then they multiply in those snails. And form many, many, many more little infected worms, if you want to call it out. And then the snail releases those, and if someone else is passing or bathing or walking barefooted in that water, then they can actually pierce through the skin of that person, and so that's how they infect new persons. So as we said before, we knew that St. Lucia had a huge problem a few years ago, or quite a few years ago, in the 1940s, 50s, 60s, and there was a program. St. Lucia actually had a program to address that because so many persons were infected. Persons were having the signs such as big stomachs because the liver gets enlarged after a while, and the spleen can get enlarged too. And persons can also become anemic. The blood can get low because these worms actually feed on the blood whilst they're inside of the body. So we had that problem a long time ago. We are seeing very, very few cases right now, but we still need to verify that we have eliminated the disease. So on initial infection, sometimes persons may not even know that they're infected. Sometimes persons may have a little itch at the site where the worm finds its way into the body. But most persons show no symptoms at all in the initial stages of the infection. So the worms can be there, going through the body, laying their eggs, and it's when they lay the eggs, the body actually reacts to the eggs, which can be deposited in the liver or in the intestine. And when the body reacts to these eggs, then you can get fever, chills, muscle aches. But as you would realize, most of those symptoms are similar to symptoms of other diseases, so it wouldn't be clear initially that one is infected with the disease. And this is actually the reason why we need to do the survey to verify what the status is. We believe that we have eliminated the disease. So we're expecting to see very few children. We'll be sampling about 2,000 children, and we're expecting a very low prevalence, maybe even less than 10 children would be infected. That's what we think. But we still need to check, we need to verify, we need to know what the situation is. And if by any chance we realize that we do have a bigger situation than we think we have, then we would have to re-implement our program that looks at schistosomiasis and Bilharzia and ensure that anyone who might be exposed or infected is treated. And there is treatment available. There is a particular medication that persons can take to cure them of the disease.